currently on a medication called Everlimus. It's also known as Afinitor. It was actually approved back in April of 2018 to be used for patients with TSC. So the whole purpose of using Everolimus, it's like a protein blocker. Some cancer patients even use it. It could be thought of as a chemotherapy. So the way we use it is it actually helps treat, or it's actually helped reduce the tumor in my daughter's head, the big one, which is the SEGA. It was pretty large. It was about 3.2 centimeters by the time we saw it, and she's been on about 3 years at this point, 3 or 4 years that she's been using it, probably even a little bit more, but her tumor is down to 1.65, I think it is now, centimeters. So yeah, it's done a tremendous thing for my daughter. So today I'm going to talk to you about Everlimus, seizures, and scary MRIs. So welcome to my channel. If you're new here, and to my seasoned subscribers, welcome back. On Mondays, I do videos all about fashion and accessory, which is my hobby. And on Fridays, I do videos all about TSC and FSGS. Both of those are genetic disorders or diseases that both of my daughters have and are currently overcoming in all of their freaking challenges, and boy are there many. So if you're interested in either or, please hit the little subscribe button, hit the little bell so you can be notified on all of my latest videos. And let's get started. With Everlimus, the side effects are, there is like a slew of them: cough, shortness of breath, anemia, swelling, painful frequent urination, hair loss, cold symptoms, rash, not the fun ones, diarrhea, vomiting, bruising, bleeding. Also, when you take the medication, it has a very common side effects of giving you blisters in the mouth, because it's a chemotherapy. So what I ended up doing was taking the actual pill and putting it inside of a mini marshmallow, and she was able to swallow it with water, and no more mouth blisters, which was tremendous, because in the beginning I was just trying to find a way to do this without causing her any issues, and that has been a game changer. So with Everolimus, my youngest daughter has to have MRIs on every six months. She is tasked with having to go and get an MRI done. So this past last week, actually, yes, sorry, the 30th, I think it was Tuesday. So Tuesday, she had to go in and get an MRI. So with my daughter, she has not had any consistent seizures for a very, very long time. But if she's put into a very high stressful situation, she can be prone for one. Either that or is super overheated. So in this scenario, what ended up happening was when we went to our usual hospital, the building and the other location where she always does her MRI is actually closed down for construction. So we had to go to a different portion or different part of the hospital. So when she was sitting in the room, this was a very dark room. I was so used to her already she was used to doing it. She was, prior to the past 2 years, actually about 1.5 years, she had to be put to sleep to actually do the MRI, because she would get so, overly anxious and very nervous, which would lead to a possible seizure. So on Tuesday, when I was seeing the signs of her getting very, very overwhelmed, so what we had her do, she was sitting down in a chair. We put a little table in front of her so that they can put in her needle, just because it is done we have to do both with and without contrast. So when they went to put the needle in, or they were setting her up, she was becoming overly anxious, very nervous. You could see it in her face, and her complexion was pale. You could see it in her eyes, and she had a stare-off seizure. So she was unresponsive for about 10 seconds. She was just staring off to the left, which is very common when it comes to her stare-offs. She wasn't responding. She was just focusing on the side there. So once she got out of it, I was teaching her how to do her breathing exercises, which we've done prior to, and she was calming down. They were able to get the needle in. So they brought her into the room. I normally don't go in because she's already a little older. She was doing these frequently. So she went in, and the nurses came back out about maybe 10 minutes later, asking me to go in because she was very overwhelmed. She was very nervous. So I did end up going back into the room, and it was about, I'd have to say like another 10 minutes where I was going through the process of getting her to calm down, again, breathing exercises. Now, a big part of the MRI process for my daughter is that she can't wear the goggles, which you can see a movie through. It makes her feel very claustrophobic. And that was the biggest part of this time around. She, in the other section of the hospital, you know, she's now being thrown out of her comfort zone into this other location that was very dark and dreary, almost felt like an operating area. She was getting really nervous. And they never used the goggles. So what they were trying to do here in this section was they were just trying to, you know, get her, hey, watch a movie, calm down. You know, obviously, for those of you that understand how nervous it can be, or just how stressful of a situation that can be, you already understand when it comes to doing an MRI. Even my parents have to be drugged up to even go and do an MRI. I even got nervous when I had to do one when I was donating to my oldest daughter, donating my kidney. I was even kind of nervous. And as I've gotten older, I've recognized that certain situations where I was more comfortable with, I'm getting more and more nervous. So eventually I was able to calm her down, and we only gave her music to listen to. So they just put her headset, and then they put a little, I thought this was a great idea, they put a little mirror on her head. I don't know what the proper term is for that, but on her headgear, they put a little mirror, and I sat at the end of her feet. When the machine would move in, move out slightly here and there, she could see me, and I would smile to her or I'd make a little silly face to her, and she was completely more relaxed. But prior to that, she was freaking out. Like, I wasn't sure we were going to be able to get the actual MRI done. But thank goodness we were able to do it. So once the MRI was done, it was about 20 minutes here and there. They would take pictures here and there. We went to see the doctor. So it's an all-day event. We go in about 10:30. We'll be done like around 12:30. Then we walk to the other section of the hospital. We go see my favorite doctor, Dr. Larkin, and my favorite nurse, Miss Leslie. And they are both out of the Tampa St. Joseph's Hospital, which they are amazing for. They are amazing. And I would recommend that hematologist office anytime. I mean, they have done wonders for my daughter. And hopefully later down the weeks, later on, my focus is to build up my channel so that I can have a one-on-one interview with both Dr. Larkin and Miss Leslie on here, and then ask them all the questions that will help other parents that do have children with tuberous sclerosis complex or FSGS or any type of blood diseases that you are currently facing with or trying to pretty much manage a lot of times on your own or with your spouse, that will help give you or guide you in the right direction and give you the information that you need to make better choices for your children. So I am really excited about that and one of the main purposes that I started this channel is so that I can get my message out there. And these two fine ladies will be the ideal medical professionals to do that. And I mean, I couldn't say any more good about how much they care about my daughter and how great they've been. I mean, everybody at the facility. There's another nurse there, Corneli. She is amazing. We absolutely adore her. She's so kind and She is like right on point when it comes to taking blood work for my daughter. I mean, they don't make you wait. They're like quick on it, and they give you all the information that you need. So yes, I am a huge advocate for St. Joseph Hospital and for their hematology or pediatric hematology department there. Okay, so with that being said, my daughter got her MRI done. She still is about the same 1.65, so plans are to up her medication. She still has up until 15 milligrams. She's only taking 7.5 milligrams, so we are going to play around with it a little bit more, because the goal is, of course, is to continue to shrink that SEGA, and hopefully give her the best possible opportunity to get that thing out of there. And we do have an opportunity to do so. So as she gets older, obviously the medication levels where they're at is kind of just now at this point running steady. But we also have to manage her kidney health and make sure that this medication doesn't affect that, right? So we saw that when she started taking Everlimus, her protein levels kept fluctuating up and down until we started to adjust her food intake and the types of meals that she was eating. So it's a, as you know, if you have a child with seizures, you already know that it's a let's figure out the right medication game, right? So we are still working on that. But I'm super excited. It's positive. It's not growing. It's steady, but we want to get it to continue to shrink. So now it's the next part of our journey, right? So I want to, of course, thank you so much for listening in. So I guess the moral of this specific story is all about being patient and understanding that we're going to run into bumps in the road. She had a seizure. She hasn't had a seizure in so long, but we put her in a very highly stressful situation. So did I know it could? Yeah, I did. But do I know that she needs to have an MRI? Absolutely. So challenges, but now we know, speaking to the nurses and the doctors at that location, our focus is going to be to make sure that she goes back to her main location. Construction will be done soon, so we'll get her out of that stressful we'll get her out of that stressful situation and hopefully give her a little bit more comfort when she goes to complete her next MRI. So again, thank you so much, guys, for listening in. I hope I gave you a little bit of information that will help you kind of think things out on the next time, because I know that for those parents that do have children with seizures, it's really important to keep our kids as calm as possible to prevent, kicking off a seizure, which is terrifying for any parent. I was fortunate enough that it was just kind of a short, like 10-second sterile seizure, but still, anytime your child has a seizure, it's never good. It's never good. So thank you again for listening in, and I hope you're having an amazing day. Please do not forget to subscribe to my channel and hit the little bell so you can be notified on all of my latest videos. Comment. I can definitely, I love to hear about your stories and dealing with seizures and MRIs and how nervous you get or don't get. I love to kind of just ask a question. Feel free to. Don't ever hesitate, because I can definitely use the support of the algorithm gods. And don't ever forget to focus through and evolve. Ciao.